I know, it sounds quite interesting. It actually stands for Kitui County Health Insurance Cover. And joining me in studio to have a little discussion about that, the launch is tomorrow, is the Governor of Kitui County, Ngilu. Governor, welcome to the program.
Thank you so much.
Thank you for finding time to be here with us. I know once you're done, you're dashing to Kitui to sort of do the last minute preparations.
Correct.
Tell us about CHIC.
Kitui County Health Insurance Cover is something that when I campaigned on making sure that every person in Kitui will get good quality, affordable health care.
Okay. And
this is born out of my belief that until you have healthy people, the people you have, unless they are healthy, they will not be productive.
Okay.
And therefore, we have worked around the whole year preparing for this. We put all systems in place. We put in place our regulations, which went through the county assembly, through the Kenya law reform, and now we are already and
everything is set for tomorrow.
Set for tomorrow.
Now, give us some of the numbers here. How much will it cost your average Kitui resident?
First, let me just tell you that Kitui County is about the 6th largest county in form of geographical size, physical size, with 30,570 square kilometers, with about 1.5 million people.
Yes, exactly, 1-point-something million.
And with that kind of number of people and that size of a land, unless you have health care closer to the people, it certainly means that people will not access health care and services. Out of that, we decided that our population of 1.5 million people has about 290,000 households. And we put in our budget, annual budget, 2.9 billion Kenya shillings.
Okay.
That is now the county health budget.
For how? For a year?
For a year.
For 1 year?
This year.
Okay.
We have increased our health facilities. When I became the governor a year ago, we had about 180 health facilities. And they were all over, the sub-counties, the constituencies. And those were very few. About 80 of them, 80 other health facilities were not functional.
Okay. Of the 180?
No.
Oh,
we had 180 which were functioning. Another 80 were closed.
Okay.
So we have worked around the clock to open those ones. And they are now open.
Okay.
So today we have 262 health facilities working.
That you have confirmed your team has visited, or you visited personally?
We have visited, our teams have visited. And more than that, we have also increased now our health workers, because we have increased them, nurses, lab technologists, and recently we actually employed 35 doctors.
Okay.
We have employed nurses, we have employed clinical officers. Now we have a total of 859 health workers, all in Kitui County.
Okay. Let me take you to the big question that I'm sure the average Kitui resident is asking this morning.
Yes.
How do I join KCHIC?
How do you join KCHIC?
CHIC, tomorrow, yes.
Tomorrow we launch it officially.
Okay.
And to launch officially, we have put in place again systems that when you come, we make you a member by taking your details, your name, your family, your picture, and you have a card. That card is a CHIC card. And that will take care of you, your wife, or you and your husband and the children under 18. They will all be provided for in our health facilities by our doctors, and they will not have to pay anything once you pay the 1,000 shillings. You will also have to pay 100 shillings for the card. Once you have paid that, you'll be good to go.
So this is 1,000 shillings one-off?
One-off per year.
Okay, every year?
One-off per year, yes.
And 100 shillings for the card?
For the card.
Okay.
In the event you lose your card, you'll be expected to pay 200 shillings for replacement.
Okay.
Yes.
Okay. What does CHIC cover in terms of ailments, and what does it not cover?
It covers, first and foremost, we're looking at where you need to be treated. It will cover all ailments. What we found is very expensive are cancer diseases, dialysis diseases, this is kidney, etc., brain diseases, neurosurgeons, and we therefore will be able to cover everything else. We are also saying
except
that
for these ones.
Except for these ones,
Okay.
they are rather those are very expensive. We also have increased equipment in our hospitals, which we never used to have. Like we never used to have X-rays, we never used to have a CT scan, we never used to have ECG machines. All that now we have. We have 14 level 4 hospitals where we'll be treating people. But what I want to ask Kitui people to do is to get treated for any ailment quickly when they suffer it.
Because it's
because
cheaper.
that becomes preventive.
Yes.
We'll prevent them from ever getting so sick that they will not be able to be treated if they come. In fact, last year alone, we had 11,000 people who were admitted in our health facilities. Of that 11,000, 54% of this were treated of diseases that could have been treated at health centers and dispensaries. And it's because they delayed until they were admitted. You can see then the disease burden becomes heavy simply because somebody has not come out quickly to be treated at the village level. They wait until they are referred to our hospital.
What have you modeled your healthcare plan of? Are there any other counties you've looked at? Have you looked at some sort of international models?
Look, you know, I've traveled so much and I've seen so much, and every Kenyan will remember in the year 2003, 2008, I really fought for this same thing. For me, actually, as a governor of Kitui, it's a dream come true for me.
Okay.
That I can now actualize, implement what I believed in and what I fought for, but also to put systems in place.
Okay.
And I believe it's going to work out very well. For instance, today you know the government through NHIF are covering anybody over 70 years. So I will just have to help NHIF to register those people so that when they come to our facilities, we treat them and we take the bill to NHIF.
You take the bill to NHIF.
We are also now looking at all women who are having who have to deliver their children. We want to know them, and through our village health volunteers, they will be able to track all these women who become pregnant. We want them to come to our health facilities.
Okay.
We want to track them until the day they deliver.
It sounds like almost like the Cuban model, which
Absolutely.
is community-based.
Absolutely, so that we know where they are, who they are, any challenges they may be having with their pregnancies, so that we protect these women.
How will you handle the strain that will obviously come on medical facilities? I read a report about the Makueni healthcare system.
Yes.
And that's one of the things that was raised, that you have doctors now who have so many patients to deal with. I have a cold, I now can immediately rush to a hospital because I know I'm covered. How will you deal with that?
It's a good thing. It's a very good thing. I do imagine that at first there will be people wanting to come in to see.
Exactly.
Is it working? Is it real? Am I going to be treated, and am I going to be asked for money or be told to go home? I expect that to come forward. And when I met all our health workers only last week, they said we are prepared for it. They look forward to it. They want it. They now have increased the health workers, have increased the health facilities, and have put medicine. You know, have put
and
drugs.
it won't lower the quality of healthcare.
No.
Okay, because that's been that's a concern.
No, it will not lower the quality of healthcare.
And Kitui, let me get a last question from you.
Yes. For
a county where we know that getting food is a challenge for a certain percentage of the residents, I don't have the exact numbers, although one media article says 3/4 of the population at one point or the other might struggle with getting food. How can you guarantee them healthcare
when they don't have food?
When they don't have food.
Fortunately for us this time,
yes,
we are food secure, we in Kitui, because of
100%?
100%. Because of just one thing that we did last year. We put out money, and I'm so happy that agriculture, issues of water, healthcare are devolved. Because we only did one thing. We say to Kitui people, we know we never get so much rains. Let us plant what we know for sure we are going to get, we'll produce.
Okay.
And we gave green grams.
Green grams, I've read about that.
And we spent about 200 million shillings with the support of Kenya Red Cross, and everybody planted the green grams. And again, during the April rains, we planted green grams. And we have so much of it that today you cannot go to a home where they'll tell you they have nothing to eat.
So no more appeals?
So no more molio. no more. For now, no more.
For now, no more.
And we are going to do the same. But green gram is also a cash crop.
Okay.
And therefore, we are going to continue to look for markets for our green grams to ensure that people also can get money out of their green grams.
It seems you've taken some rather risky ventures. We wish you all the best.
But until you get out of the box, you never move forward.
You never move
forward. So we must move on it this way.
Okay.
And then remember, for 55 years, since we got independence, we have been doing things in the same way over and over again and expect different results. That will not happen. We might as well take these big risks
and see
and see what happens.
And see what happens.
And not just see what happens, you also take calculated risks.
And that's what you're starting tomorrow.
Yes. It's very well calculated. I know our people will be happy.
Good. We'll be monitoring and following, and of course we hope to have you back on in the next 6 months.
Wahiga, thank you so much. Not in the next 6 months.
Oh, you expect to see?
There are a few more things that I'm just going to launch this week.
Oh, this week?
Yeah. But we are launching so many things in Kitui that we are looking forward to everybody coming around.
Sooner than that, then, Governor. Thank you so much. Of course, the Governor of Kitui County, and for Kitui residents, you have the information you need. And of course, we'll be covering the launch tomorrow and following up on that as well. Thank you, Governor, once again. Fred, over to you with more updates.
Thank you.